head-to-toe assessment on you. Is that okay?
That's fine.
Okay, you just go wash my hands. Okay. Are you in any pain today?
No.
Any allergies I should know about?
No.
Okay. Can you just tell me your name and birthday?
Viola Pino, July 3rd, 1990.
Okay. Do you know what day it is?
It's Thursday,
Do you know what year?
2013.
Okay. Patient appears to be the stated age. There's no signs of infection. The patient is alert and oriented ×3. Her posture is slouched. There's no body odor, and the patient is well groomed. Okay. I'm now gonna ask you to close your eyes so I can test cranial nerve 5. Can you feel this? Okay. Can you feel this? Can you feel this? Can you feel this? Okay. You can open your eyes. Patient has sensory function in the face. Okay, now I'm going to test the cranial nerve 7. Can you smile? Puff your cheeks. Close your eyes real tight. Okay. Lift your eyebrows. Okay. There were no signs of any drooping, and base is symmetrical. I'm now going to inspect and palpate for any lesions or masses. There are no lesions or masses. The head is symmetrical. Okay, I am now going to find my pen light and assess the eyes. Can you just focus on my nose? Follow my pen light in. Okay. Pupils are round and reactive to light. Positive for accommodation. The pupils constrict when I bring the pen light in and dilate when I bring it out. Okay. I'm now going to assess your oral mucosa. Can you open up your mouth? Okay. The patient's buccal mucosa is pink. There's no lesions. All teeth are intact. Can you stick out your tongue and say ah for me? Okay. The uvula rises and there are no tonsils. She has no tonsils. Okay. I am now going to assess your lymph nodes for any infection. Preauricular, postauricular. There was no signs of any inflammation. Okay, I'm now going to palpate the carotid artery. Okay, there are 2 plus bolts on both sides. I'm going to now check for skin turgor. You feel it a pinch, and it went back in 1 to 2 seconds, so there's no signs of any dehydration. Okay, I'm just going to go under your eyes to check your conjunctiva, which is pink and moist. Okay. I'm going to auscultate for any signs of bruise. I'm just going to ask you to take a deep breath and hold it for me. Okay. Go. Breath and hold. Okay, good. Okay. I'm now going to assess your upper extremity. Temperature is warm and dry. There are no signs of any lesions or scarring. I'm going to assess your brachial pulses, which are +2 equal bilaterally. Your radial pulses, which are +2 equal bilaterally. I'm now going to assess for capillary refill. And it goes in 1 to 2 seconds from white to pink. Okay, I'm now going to ask you to grab my hands and squeeze as tight as you can. Okay, patient's reflex is equal bilaterally. There were no signs of any clubbing. Okay, and then I'm going to auscultate the interior lung sounds. were clear and equal bilaterally. I'm now going to assess the heart sounds. We're going to start at the right second intercostal space, which is the aorta, and then the left second intercostal space, which is the pulmonic, where S2 is heard greater than S1, and then the third intercostal space, which is S1 and S2 are equal, and then the tricuspid valve, and then the mitral valve, and this is where you can hear the apical pulse if you listen for 1 minute. And S2 is heard greatest at the pulmonic, and S1 is heard greatest at the mitral valve. Okay, I am now going to do the posterior lung sounds. I'm just going to ask you to turn this way. A and P diameter is 1 to 2. Can you read it? Good. Okay, and I'm also going to assess for the laterals too. Read it. Good. There were no signs of adventitious sound. Lungs are equal bilaterally. Okay, now I'm going to assess the vertebral ankle for any signs of infection. Just let me know if you have any tenderness.
No.
Okay, good. Okay, and now I'm going to ask you to come back over this way. Okay, and I'm going to assess for lower extremities. Okay, there are no signs of any lesions or edema in the legs. Edema, swelling, warm and dry. I'm going to palpate the popliteal pulses, which sometimes cannot be felt, but they are +2 bilaterally. And then I'm going to palpate the posterior tibial pulse, which are +2 bilaterally. And then the dorsalis pedis is +2 bilaterally. And there's no signs of any edema or swelling in the foot. I'm now going to assess for capillary refill, which would normally occur in 1 to 2 seconds, but since I can't tell because she has nail polish on. Okay, and now I'm going to assess for the Babinski reflex. It was negative for the Babinski reflex because there was no fanning of the toe. Alrighty, I'm now going to ask you to lay down. I'm going to assess your abdomen. Do you need to use the bathroom?
No.
Lift your shirt up. Okay. I'm going to assess for contour. The abdomen is flat. There's no lesions or scarring. The umbilicus is midline. I'm going to start by auscultating for vowel sounds. And I'm going to start in the right lower quadrant, where the appendix is located, the right upper quadrant, where the liver is located, the left upper quadrant, where the spleen is located, and the left lower quadrant, where the sigmoid colon is located. Vowel sounds were heard throughout all 4 quadrants. I'm now going to percuss over the abdomen, where I will hear tympanic and dull sounds. Tympanic sounds over dull sounds are heard over the organs, and then tympanic is heard everywhere else. Starting in the right lower quadrant, there's the appendix. Okay. And now I'm going to palpate. Please let me know if there's any tenderness. Tenderness? 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 No? Okay, good. There was no distended organs or enlarged organs. Okay, sit up. Okay, I'm now going to ask you to stand up. Okay, can you bend down and touch your toes for me? I'm assessing the spine, and it's midline, it's straight. Okay, you can stand up. Okay, you can close your eyes. I'm now assessing for the Romberg test, noting any swaying. Patient is not swaying. And I'm doing this for 20 seconds. Okay, you can open your eyes. Now can I ask you to walk over there to the chair? And then turn around, please, and walk back heel to toe. Okay, patient has a steady gait.